So, coming to Vataja Pratisyaya. So, how to understand Vataja Pratisyaya? Simply keep in mind, Vata is like a monkey. Vata is like always Shala, moving from one end to another, which is constantly jumping from one end to another. Nasal obstruction is the main symptom in Vataja Pratisyaya. Whenever a patient comes with nasal obstruction, the first thing that comes to your mind should be Vataja Pratisyaya. Sometimes, how did this Vataja nasal? Sometimes a nasal obstruction will move from left nose to right nose to left nose. Night left nose will be blocked, in morning right nose will be blocked. So which keeps on changing, which keeps on playing kabaddi with you is that which is Vataja Pratisyaya. So symptoms like keep on changing. It's like sometimes lot of sneezing will be there, and sometimes sneezing will not be there, and sometimes a lot of nasal discharge will be there, and sometimes only dryness of the mucosa will be there. The person will feel a lot of dry. Sometimes soreness of throat and loss of voice will also be associated. And simply to put, Vataja Pratisyaya always moves from one symptom to another. So it is mainly you find it with nasal obstruction, and sneezing will be more in Vataja. In Pitta also it will be more, sneezing in Vataja Pratisyaya also it will be more. And that which is sometimes nasal discharge will be there, and sometimes nasal obstruction will be there. That is how this altering symptoms in all diseases always belongs to Vata. So Vataja Pratisyaya, and sometimes Kaphaja or Pittaja Pratisyaya, when it is long standing, when it becomes more than 1 year, it always gets down to the Vataja Pratisyaya stage. So before treating a Vataja Pratisyaya stage, you should always inform the patient that, see, you have come to me in a chronic condition. You have had these symptoms, almost nasal obstruction, sneezing, nasal discharge. You have had the symptoms for 3-4 years. I cannot do magic within 1 or 2 months. So I need minimum 3 months of treatment, and then maintenance medicine like Chyawanprash for the next 6 months, and then only you will get result. For the patients, you should definitely tell this, because they'll be used to using antihistamines always on a regular basis. They'll have cetirizine for years together, they'll have levocetirizine for years together, and then you come one day, definitely stop cetirizine, levocetirizine, have some kashaya lehya, you will get result all over the night. That is what the patient expects. Definitely it's not possible. And if the patient insists that he gets result early, it's better to avoid such patients, because Vataja Pratisyaya is not something which is of recent origin, and it cannot be cured by giving some mere 1 week or 2 weeks of medicines. It needs patience, and people who are Vataja Pratisyaya along with Vata Prakriti, people who jump from one doctor to another, do not take medicines properly, please don't take such patients. They will also destroy our name as well. They are not ready to take for long term, and they are not ready to follow Patya. Definitely they will also damage your reputation as well. So Vataja Pratisyaya is something that needs to be treated for months together. So Vata is Shita and Ruksha. How do you treat Shita and Ruksha? You give Ushna and Snigdha Guna. So how to give Ushna and Snigdha Guna? So what are the medicines that can be chosen? Amrutotram Kashayam is a very beautiful medicine according to the condition, because it contains Amrita, Haritaki and Shunti. What Haritaki does is usual reversal of the pathology. That is, Vata Pratiloma Gamana is cause of Samprapti of Vataja Pratisyaya. Haritaki does the Anuloma Gamana of the Vata, thereby permanently curing the disease. So Amrutotram Kashayam or Amritotra Kashayam tablet has to be given on a regular basis. That gives most beautiful results. Shunti also takes care of the excessive nasal discharge and nose blockage as well, and Amrita takes care of the allergy that is excessive kleda. So it's a very beautiful Tridosha combination, and Amritotram Kashayam handles all the particular symptoms at a particular point of a single point of time, and it is very beautiful medicine to choose in Vataja Pratisyaya. What else I can choose? You can choose Vayu Guliga. They always tell for Vataja Pratisyaya, Vayu Guliga, Ashalyadi Guliga. There is a medicine in Kottakkal and other, that is called Ashalyadi. that medicine is also very beautiful in treating nasal blockage. Usually when the patient comes, I usually choose Vayu Gulika Rashalayadi to relieve the nasal obstruction. See, nasal obstruction can also be structural. It can be because of deviated nasal septum. Vata kind of nasal obstruction is that which shifts from one time to another. Sometimes it will be left nose, sometimes it will be right nose, and it's not structural. It is a functional. When Vataja Pratisyaya is involved, the blockage is always functional. It's not structural. So you need to understand that. So the basic prescription will always contain Amritotram Kashayam, Vayu Gulika and Nishamrita. If excessive sneezing is there, definitely. I told all the doshas I use Nishamrita. There is an open statement. This is a Vyadhi Pratyanika treatment. And the combination, the Amrita Arishtam, Vasa Arishta and Bala Arishta. I don't usually use Arishta in Vataja patients. In very rare case I use, because Arishta again is Ruksha. It will increase the Vata. So Amrita Vasa Bala I will give whenever the conditions use. I will not give regularly. So the usual prescription is Amritotram Kashayam, Vayu Gulika and Nishamrita. And the most beautiful prescription, the Vyadihara, not Vyadihara prescription, the Hetu Vyadihara prescription is Chavanaprasha. Chavanaprasha is a perfect definition of Ushna and Snigdha. It contains all the drugs in that treat which is Ushna enough to treat Vata and Snigdha enough to treat Vata. So Chavanaprash Kashayam, I will only recommend Imcorp's company Chavanaprasha or AVP company Chavanaprasha. I also have made a video on that, and it is very beautiful, Chavanaprasham. So in treating the allergic rhinitis, long-standing allergic rhinitis, wherever nasal symptoms is involved, wherever the symptoms jump from one place to another. See, it's very simple. You have excessive nasal discharge, and you identify that it is a Kafaja Pratisyaya. There you have to give Agastya Rasayanam. You identify that it is Vataja Pratisyaya, keeps on shifting from one direction to another. There you have to choose Chavanaprasham. It's very simple. So whenever Amritotram Kashaya, Vayu Gulika, Nishamrita, etc., I'll be using definitely for minimum of 45 days to 3 months. Minimum of 45 days to 3 months, and then Chavanaprasha again for 3 months. Only Chavanaprasha I will continue. If the patient gets all the symptoms subsided, I will continue only Chavanaprasha for the next 3 months. Because Vataja Pratisyaya is not something that can be easily treated, and even it jumps. When you give medicine, suddenly the patient will feel a lot of relief, but after 1 week they will get same symptoms again. So another point to consider is if the patient is having long-standing use of, they have habit to take cetirizine or levocetirizine, it is very, very difficult initially to leave cetirizine or levocetirizine and give treatment. You have to find a way to taper these. For example, they are taking 10 mg, you have to give 5 mg tablet daily, and use the tablet only when the symptoms subside. Use the tablet only when needed, only when increases, because Vataja Pratishyaya, it jumps. It suddenly reduces and it suddenly increases one day. The patient will follow some pathya, they will go have some ice cream, suddenly Shita Guna increases. So much watering of nose will be there. So that time definitely they have to take cetirizine or levocetirizine, because they are used to taking antihistamine. For such patients, doctor has to have patience, and they have to educate the proper usage of cetirizine and levocetirizine, but ultimately we can get rid of it. And sometimes it is for at least 2% of the patient, it is almost incurable to treat Vataja Pratisyaya. There are definitely cases in which I failed miserably to treat Vataja Pratisyaya because it is long standing. It is more than 5 years and 6 years. Tell the patient, I can only try. I cannot tell you that I can definitely give you result. So always protect yourself before saving the patient, because they will use your word as an advantage at last. Chronic long-standing patients who use cetirizine for 6-7 years, definitely the dosha won't come down within 2 months. It's very difficult to treat them with sometimes with all possible things, nasya, etc. It's still very difficult to deal with them. So this is the end of Vataja Pratisyaya. And coming to the diet in Pratisyaya, you definitely ask the patient not to take excessive cold items or excessive oily foods, etc. And excessive use of dadi in night also can cause Pratisyaya. And you can refer all of the Nidanas and Charaka, and you can advise to the patients. Thank you.